The femur is also known as the thigh bone, and the word femur in Latin means thigh. It is the longest and strongest bone of the body. I'd like to begin by acknowledging the source of the images I will use in this video. I photoshopped the images from original images that come from the Anatomy Standard website. The website link can be found in the description below. The femur contributes to the ball component of the ball and socket joint, that is the hip joint. And of course, the hip joint is clinically important because fractures often occur in this area, and hip replacements are common, particularly among elderly people. Here are three different views of the proximal end of the bone. On the left, you have an anterior view, a medial view is in the middle, and on the right, you have a posterior view. The round hemispherical articular part of the femur, in other words, the ball of the ball and socket joint, is called the head of the femur. It is securely placed in the acetabulum, the socket component of the hip joint, by the conforming shape of the bones and the muscles and tendons that surround it. But it is further stabilized by a ligament that attaches to the hip bone in the acetabular fossa. The place where the ligament attaches to the head of the femur is indicated by a divot or dimple that is called the Fovea capitis femoris, which translates into depression on the head of the femur. The head, of course, has to have a neck, and the pyramidal base below the head is called the neck. The muscles that move the femur are large and many, so the processes where they attach are also large. These processes on the proximal end of the femur are called trochanters. The word comes from a Greek word which means to run. This is the only place on the human skeleton where you will see this term used. There are two trochanters. The larger one is lateral and is called the greater trochanter. The smaller one is medial and is called the lesser trochanter. A ridge of bone connects the greater and lesser trochanters on the posterior side. This prominent ridge is called the because it is between the Intertrochanteric crest. On the anterior side, where the trochanters are further apart, a more subtle linear elevation of bone is between the trochanters. It is called the Intertrochanteric line. Below the lesser trochanter, on the medial side, there is a line to which the pectineus muscle attaches. This line is called the Pectineal line. If we look at the entire length of this long bone and concentrate on the posterior side, there is another prominent ridge that runs along the back that is rough because of the attachment of muscle tendons. Because of the roughness of the line, it is called, in Latin, the linea aspera, which translates into rough line. Here is the distal end of the femur. First, note how the femur tends to angle slightly medially. One of the adductor muscles, the adductor magnus, pulls the femur medially and attaches to a tubercle that is found here. It is called the adductor tubercle. The adductor tubercle is on the medial side, and the medial and lateral sides are now indicated. Now let's look at the posterior side first. Where the linea aspera ends, two lines begin and diverge distally. These linear elevations are respectively called the medial supracondylar ridge and the lateral supracondylar ridge. The surface between these ridges, which is essentially behind the knee, is called the popliteal surface. The Latin term popliteus refers to the back of the knee. On the end of the femur, there are two round, smooth surfaces that resemble the bottom of two tires. These articular surfaces are called condyles. The word condyle comes from a Greek word that means knuckle. This is why the ridges just described are called supra above supracondylar ridges. We can now identify the medial condyle and the lateral condyle. The recess between the condyles is a type of depression, or fossa, and is called the intercondylar fossa. If we look at both the anterior and posterior at the same time, the bone above the condyles that expands the surface for the attachment of ligaments and tendons are called epicondyles. Epi is a prefix that means above or on top of. So you have the medial epicondyle, where we find the adductor tubercle, and the lateral epicondyle. On the anterior side, the condyles fuse and form the smooth articular surface on which the patella of the knee, or the kneecap, will glide. This surface is called the patellar surface. This concludes this video on the femur. Please look at my other videos. I have many other videos on the skeleton. I've almost completed all the videos on the skeleton. And if you like my videos, please subscribe and like. And finally, here is another cat video.